Welcome to the deep dive. Today, we're zeroing in on a joint that's just fundamental to so much of what we do.
Mm-hmm.
But we probably only really notice it when something's wrong, you know? Oh,
Yeah,
Zach, think about it, reaching for stuff, waving hello.
yeah.
It's always working.
It is. It's so easy to overlook, but underneath, it's this remarkably clever bit of biological engineering.
Right.
So in this deep dive, we're going to unpack the key parts. We'll look at the bones giving it structure, the muscles making it move, the strong ligaments keeping it stable.
And the blood vessels and nerves, too,
Yeah.
right? Keeping it all running.
Exactly. The whole network.
Okay. We've looked into some really great material that shows just how intricate this joint is. Our aim today is to give you a clear, engaging picture of this pivotal hinge.
So you can appreciate what it does for you every day.
Right. Let's dive in, starting with the basics. The bones, the framework.
Okay. So the elbow is what we call a synovial hinge joint.
Like a door hinge.
Pretty much, yeah. It mostly allows movement in one plane, bending and straightening.
Yeah.
And it connects your upper arm to your forearm.
Okay.
It's where three bones meet.
Yeah.
The humerus, that's your upper arm bone.
All right.
The ulna, which is the forearm bone on the pinky side.
The medial one.
Right, the medial one. And the radius, the other forearm bone on your thumb side, the lateral one.
Okay, so three bones meeting right there. How do they actually, fit together for that hinge movement?
Well, there are two main spots where they connect, where they articulate. First is the humeroradial joint.
Humerorulnar.
Yeah, so a part at the end of the humerus, kind of spool-shaped, called the trochlea.
Trochlea.
Fits really neatly into a notch on the ulna, the trochlear notch.
Yeah.
This connection is the main player for flexion and extension, bending and straightening your arm.
Got it. So that's the core hinge part. What about the radius? Where does that fit in?
Good question. The second main connection is the humeroradial joint. Here, a rounded knob on the humerus, the capitulum, meets the head of the radius. Now, this joint helps with bending and straightening, too, but it's also involved in rotation.
Ah, rotation, like twisting your forearm.
Exactly. Yeah. Though the main forearm rotation, turning your palm up and down, pronation and supination, technically happens more at the joint just below, the proximal radioulnar joint.
Right, where the radius and ulna meet near the elbow.
Precisely. Even though muscles drive that twisting, mentioning this joint here is important because its structure is key to allowing those movements.
Okay, that makes sense. So three bones, two main connections for the hinge action, and another nearby that's critical for the twisting. That sets us up nicely for the muscles.
It does.
It always amazes me how many muscles are involved in things we don't even think about.
Oh, absolutely.
Yeah.
For the elbow, we're looking at four main movements. Flexion, which is bending.
Uh-huh.
Extension, straightening. Pronation, turning the palm down. And supination, turning the palm up.
Okay, let's start with bending. Flexion.
Right. For flexion, it's really a team effort. The biceps brachii are probably the most famous one.
Bones, yeah.
Yeah. It's a primary flexor. But then there's the brachialis, another really key muscle for bending, sits underneath the biceps.
Oh, interesting.
And the brachioradialis also helps out with flexion. So it's not just the biceps doing all the heavy lifting, so to speak.
So the biceps isn't the only star there. What about straightening the arm back out extension?
Extension is mainly handled by the triceps brachii, that big muscle on the back of your upper arm.
Right.
It's the prime mover for extension. There's also a smaller muscle, the anconeus, that kind of pitches in to assist.
Okay, and then those twisting motions, pronation and supination.
Exactly. Pronation, turning your palm down, involves mainly two muscles, the pronator teres and the pronator quadratus.
Right.
And supination, turning your palm up, that relies on the supinator muscle. But what's interesting is the biceps brachii actually helps with supination too.
Really? The biceps helps turn the palm up?
Yeah, especially if you're doing it quickly or against resistance. It's quite the multitasker.
Wow, okay. It really is amazing how they all coordinate. But what keeps everything stable? What holds the bones together during all this movement? That must be the ligaments.
Precisely. You need strong ligaments for joint integrity, especially under load. On the inside of your elbow, the medial side, you've got the ulnar collateral ligament, the UCL.
Ah, the UCL. I've definitely heard of that one. Tommy John surgery, right?
That's the one. It's absolutely critical for resisting what's called valgus stress.
Valgus. That's force pushing the forearm outward.
Exactly. Relative to the upper arm. Huge stress for throwing athletes, like you said, baseball pitchers.
Makes sense. What about the other side, the outside?
On the lateral side, the outside, there's the radial collateral ligament, the RCL.
Okay.
Its job is to resist varus stress force pushing the forearm inwards.
Got it. Valgus outwards, varus inwards, UCL and RCL. Any others?
Yes, there's another really important one, the annular ligament, Yeah, it's like a ring or a collar. It wraps around the head of the radius bone
Uh-huh.
and basically holds it snugly against the ulna. This is essential because it lets the radius rotate for pronation and supination while keeping things stable at the elbow joint itself.
So the collateral ligaments handle the side-to-side forces, and the annular ligament handles the rotational stability for the radius.
You've got it. They all work together, these incredibly strong straps, keeping everything aligned but still allowing movement. It's a fine balance.
Definitely. Now, all this activity, muscles contracting, bones moving, needs fuel, needs blood supply. How does that work?
The elbow gets a really rich blood supply.
Yeah.
It mainly comes from branches off the brachial artery, the main highway artery in your upper arm.
Okay.
Key branches include the profunda brachii artery and then the radial and ulnar collateral arteries.
Collateral again. That sounds like a backup.
Exactly like a backup. What's really clever here is how these arteries form this interconnected network around the elbow. It's called an anastomosis.
Anastomosis. Okay.
Think of it like a series of bypass roads around a city center. If there's a traffic jam, or in this case, if one vessel gets squeezed when you bend your elbow,
Mm-hmm.
blood can still find other routes to get where it needs to go. It guarantees continuous blood flow.
That's smart design. You really wouldn't want the circulation cutting off every time you bent your arm.
Definitely not.
Yeah.
It shows a kind of built-in redundancy, which is great engineering, biologically speaking.
Okay, so bones, muscles, ligaments, blood supply. The final piece is the nerves, right? Controlling the muscles, providing feeling.
Absolutely essential. Several major nerves run past or supply the elbow region. The musculocutaneous nerve, for instance, mainly powers the flexor muscles on the front, like the biceps and brachialis.
Okay.
The radial nerve generally takes care of the extensors on the back, the triceps.
Right.
Then the median nerve, that one innervates some of the pronator muscles, among other things further down the arm.
And the famous one, the one everyone knows.
Ah, yes, the
Yeah.
funny bone nerve. That's the ulnar nerve.
Right.
It runs in a little groove behind that bony bump on the inside of your elbow, the medial epicondyle. It's quite exposed there.
Yeah, you really feel it when you hit it.
You do. That zinging, tingling feeling is just the nerve getting bumped against the bone. But beyond moving muscles, these nerves also have tiny branches, articular branches,
Uh-huh.
that go into the joint capsule itself. They provide sensation from the joint.
So your brain knows where your elbow is.
Precisely. It's called proprioception. Your brain gets constant feedback on the joint's position and movement, even if your eyes are closed.
So it's not just signals to the muscles, but signals from the joint back to the brain. It really highlights how connected it all is.
It really does. You look at the elbow. It seems like a simple hinge, right? But it relies on this incredibly precise, coordinated dance between all these parts.
Yeah.
The bone shapes fitting perfectly, the muscles pulling in just the right way, the ligaments holding strong, the blood keeping everything nourished, and the nerves conducting the whole orchestra.
Okay, let's sort of wrap this up. This deep dive really shows the elbow is so much more than just a hinge. We've touched on the three bones meeting there, the different muscle groups for all the movements, bending, straightening, twisting.
The crucial ligaments providing stability, UCL, RCL, annular.
Right, and that clever backup system in the blood supply, the anastomosis.
And finally, the nerves,
Yeah.
controlling movement, but also sending back that vital sensory information.
And if you think about the bigger picture, at any problem with just one of these parts.
Oh, yeah. A ligament sprain, a pinched nerve, poor blood flow. It can really affect how your whole arm and hand work. It just shows how interdependent everything is.
Absolutely. So the next time you reach for a coffee cup, type something out, wave, maybe just take a second to appreciate this pretty remarkable piece of engineering in your arm.
It really is a testament to the complexity hidden in plain sight in our bodies.
Makes you think, doesn't it?
It does. And here's something maybe for you to chew on. Think about how often you rely on your elbow's precision without a second thought. What other joints, ones that seem simple on the surface, might be just as complex underneath? Something to ponder next time you move.